What we know about Omicron is that it is here in the United States. It's in about 60 countries all around the world. In terms of the virus and the disease it causes, what we do know is that it is more infectious than Delta variant. We know that more people, whether they had previous infection or not, are having recurrent infections. It generally is milder than the previous variants so far, but we're still learning about the rates of hospitalizations and deaths from Omicron. Most of this data is coming from South Africa. In some areas in South Africa, there have been an increase in hospitalization rates. However, this information is still pending. What we also know about Omicron is that the vaccines have a lower protection against Omicron compared to Delta or other variants. The people who had COVID-19 infection before and received 2 doses of the mRNA vaccine seem to be more protected than the people who only just had 2 doses of the mRNA vaccination. What that tells us is that combining either infection with 2 doses of mRNA vaccine or getting a booster after your 2 doses of the mRNA vaccine or J&J vaccine is really important in terms of protection that we can garner against COVID-19 caused by Omicron. That is what we are finding, that people are having symptoms that are very similar to a common cold, which is what what the vaccination does is, particularly for people who are vaccinated, they may only have cold symptoms and they may just blow it off as just some other respiratory virus. But it's really important to get tested because there is no specific symptom that differentiates it from another coronavirus or another respiratory virus that's out there. So have a low threshold to get tested if you have symptoms or even of just a cold. It's really important for people to get tested. Get tested early, get tested frequently, even if you're sure that it was not Omicron, you may not know that it is not Omicron. So it's better to be tested, better to know, better to be able to protect yourself and others in your community or in your work environment. We really recommend early testing. Also, it's important to be able to differentiate it from influenza, particularly for people who are immune compromised or people who are older, elderly patients, because we do have treatments for influenza that we would want to recommend. And we also have treatments for COVID-19 infection, whether it's caused by Omicron or Delta, in terms of people who are immune compromised. We know that the vaccines provide very good protection against hospitalization and severe disease. Recent data shows that about 70% protection against severe disease caused by Omicron. So important to get vaccinated if you're not vaccinated. Second is important to get a booster if you have not gotten your booster yet, because boosters will definitely improve your antibody immune responses against these viruses. In fact, even better than the second dose. So it's really important to get the booster. Those boosters are also particularly important for people who are immune compromised. However, for the immune compromised, I do want to just tell them that we are recommending an additional dose after your first 2 doses of the mRNA vaccine, and then get a booster 6 months later.